Over 80% of couples where the woman is younger than 40 years old will get pregnant within a year of trying. That is, when they're having regular intercourse and not using contraception. Clinically, a couple are considered infertile if they fail to get pregnant during a year of unprotected intercourse. This doesn't mean they can't get pregnant, but should be a trigger for investigating whether there's an underlying problem. Male and female problems contribute pretty much equally to problems getting pregnant. In about another third of couples, either the problem can't be identified or both partners have fertility problems. Infertility in women is mostly explained by three problems. Problems with ovulation, meaning that the oocyte doesn't get released. Problems with the oviduct, known as tubal factors, meaning that sperm and oocyte don't meet. And problems with the uterus or peritoneum, preventing the embryo implanting and developing normally. Let's look at these female fertility problems in a little more detail. Ovulation. Failure to ovulate is the most common female cause of infertility and occurs in about 40% of women who are having problems with their fertility. If an oocyte isn't ovulated, then it won't be present in the tract and able to be fertilised. Sometimes women don't ovulate or only sometimes ovulate because of problems with the ovaries themselves. For example, women with few oocytes, as happens in ageing, are less likely to ovulate. Conditions such as polycystic ovarian syndrome or PCOS also mean women may either not ovulate or not ovulate regularly. In many women with PCOS, oocytes start to grow but do not finish developing or ovulate. Their ovaries contain many follicles below the surface, sometimes described as looking like a string of pearls on ultrasound. You can see the multiple follicles inside this ovary from a woman with anovulatory PCOS, where ovulation doesn't occur. Finally, anything that disrupts the hormones that control the development and maturation of the oocyte and trigger ovulation from the ovary will impair ovulation. This includes some modifiable factors such as obesity. Reducing weight by as little as 5% can restore regular menstrual cycles and ovulation. Tubal factors. This type of problem happens in about 1 in 5 couples who are infertile. If the oviducts are blocked, oocytes are not able to move from the ovaries to the uterus, and sperm is not able to reach the oocyte for fertilisation. Some women with endometriosis may develop scarring in the oviducts, and damage can also be caused by STIs. Untreated gonorrhea and chlamydia in women can lead to pelvic inflammatory disease, and in turn to scarring that blocks the oviduct. Uterus and peritoneum. These are less common problems than ovulation failure or tubal infertility. Some women are infertile due to problems inside the uterus, such as scarring or fibroids. Scarring can make it harder for an embryo to implant in the lining of the uterus, the endometrium. Large fibroids inside the uterine cavity can physically change the shape or position of structures or interfere with blood supply to the uterus. External scarring and adhesions, literally sticking together of tissues, as happens in severe endometriosis, may disrupt the positions or functions of reproductive organs too. As well as problems that prevent fertilisation or implantation, couples may take longer to have a baby if they lose their pregnancies early on. Poor embryo quality is likely to lead to early pregnancy loss. This is a particular problem in older women since damage accumulates in the oocytes remaining in the ovary. This means that the risks of major genetic problems increases in embryos from older women. And these embryos often fail to develop and implant or are lost early in pregnancy. Next, you'll find out more about some of the issues associated with female ageing, fertility, and early pregnancy loss or miscarriage.